So, today we're going to dive into something pretty incredible, a technology that acts like an electrical GPS for our most vital organ. How do doctors map the heart's activity in real time without ever making an incision? Well, we're talking about thoracic ECG leads.
I mean, think about it. When a heart attack is happening, every single second counts. Doctors can't afford to just guess which part of the heart is in trouble. So, how in the world do they pinpoint the exact location of the damage and do it fast?
And the answer? Well, it's actually brilliant in its simplicity. It's this non invasive mapping system that uses electrodes placed right on the chest. You can think of these leads as tiny cameras, and each one gives doctors a unique electrical picture of the heart's activity, all without a single cut. So let's see how they set these cameras up. All right, so it all starts with a foundational setup, the 6 standard chest leads. These are the primary landmarks on our map of the heart, and they're known as V1 through V6. Now, the placement of these leads is incredibly precise. It's not random at all. First, V1 and V2 go on either side of the breastbone, in the fourth space between the ribs. Then, and this is kind of interesting, clinicians actually skip ahead to place V4, a little lower in the fifth intercostal space. Only then do they place V3, fitting it neatly right between V2 and V4. And finally, V5 and V6 wrap around the side of the chest, all on the same level as V4. You see? Every single position is totally deliberate.
So, why all this precision? Well, because each lead provides a unique view into a specific part of the heart muscle, the myocardium. V1 and V2 give us a look at the septum, that's the wall between the ventricles. V3 and V4 show the front wall and the very tip or apex of the heart. Meanwhile, V5 and V6 give us a clear picture of the side wall of that powerful left ventricle. This whole idea is what's known as topical diagnostics. You're literally using the location to diagnose the problem. Okay, so now that we know what each individual camera is looking at, the next step is to group these views together. This gives doctors an even broader understanding of the heart's chambers and, really, the electrical flow between them.
This is where the map really starts to come together. The system simplifies all this data by grouping the leads. V1 and V2 become the right thoracic leads. They're showing the activity in the right side of the heart. V5 and V6 are the left thoracic leads, which are focused on that powerful left ventricle. And right there in the middle, V3 and V4 form the transition zone, revealing the electrical bridge between the two sides.
But here's the catch. The standard 6 leads, they are fantastic for viewing the front and the side of the heart. But the heart is a three-dimensional organ, right? What about the back?
And this is a huge question. If a heart attack happens on that posterior wall, the standard leads, well, they might just miss the signs completely. To solve this, we need more cameras to get that full 360-degree view. And this is where leads V7, V8, and V9 come to the rescue. Their whole purpose is to see that posterior wall. They're placed at the same level as V4, but they wrap around the patient's back, one along the back of the armpit, another in line with the shoulder blade, and the last one right next to the spine. This simple addition gives doctors that absolutely critical rear-view perspective. So we've covered the standard map, but sometimes doctors need to zoom in. They need an even more specialized or high-resolution view, and this is where advanced mapping techniques come into play.
Yeah, if the standard leads are your wide-angle cameras, think of these specialty techniques as this super powerful zoom lens, or maybe even the drone. They offer unique angles and high-density information for those really tough-to-diagnose cases. First up is the knee bleed system, which is, honestly, it's a really clever approach. Instead of the standard layout, it arranges 3 electrodes on the chest to form this unique diagnostic triangle. And this setup creates 3 entirely new perspectives, labeled D, A, and I, giving doctors powerful new insights into the walls of the left ventricle. And this quote right here just brilliantly illustrates the power of getting a new perspective. The D lead, which stands for dorsalis, is singled out as being especially valuable. It provides a view that is exceptional at diagnosing heart attacks in the posterolateral wall, a very specific and critical area that can sometimes be really tricky to see. But what if doctors need the ultimate close-up? That's when they turn to something called precordial mapping. This technique goes way beyond just a few key views. It's about creating a highly detailed point-by-point micromap of the heart's electrical field, which lets clinicians spot tiny changes that a routine ECG might otherwise miss. Okay, get ready for this. While a standard chest ECG uses 6 leads, precordial mapping uses anywhere from 35 to 60 electrodes applied to the chest. I mean, that's a massive increase in data points, creating an incredibly high-resolution electrical image of the heart. So, the crucial takeaway here is this. Whether it's the standard 6, the extended 9, or this incredible grid of 60, every single one of those electrodes is placed with absolute purpose. Each one is a deliberate step in building a comprehensive, life-saving electrical map of the human heart.
And that leaves us with a really fascinating thought, doesn't it? We've gone from just a few leads to these incredibly detailed micromaps. As this technology keeps evolving, and our electrical maps of the heart get even more detailed, you have to wonder, what new frontiers of cardiac health and disease will